Hey legends, I'm Eliza Lee and you're listening to The Making of an Incredible MD, the podcast for aspiring medical professionals. Last season, we geared you up with a ton of different topics and ethical dilemmas to think about in the medical field. And on this season of the podcast, we're taking you behind the scenes of live MMI Mock Stations that we run for our students who are about to sit their med interviews. So stay tuned for a new station each week and hear a handful of our future med students give it a good old crack. Today on Station 3, we have one of our University of Melbourne examiners here at Halad, Jack, interviewing one of our aspiring med students, Jess. Before we hit record, we give each student 3 minutes to read the station and they have 8 minutes to respond. And today, the station that Jess read was this. You are a GP and supposed to finish your shift in 5 minutes, but still have 4 patients left waiting in the waiting room. You calculate that you can get through the remaining patients within the next hour and then head home, meaning you'll be able to make it in time for a family event you promised your partner that you'd be able to make. Just prior to seeing one of these patients, the local nursing home calls you to tell you that Mrs. Andrews is failing dramatically. You've been looking after her and her family for over a decade. Mrs. Andrews and her family had previously agreed to a do not resuscitate order, a DNR, so that when she became ill again, she could die comfortably but without intervention. The family is now questioning whether they made the right decisions and want to discuss this with you as soon as possible. Now, the first question that Jack asked was, what factors are important in this situation and why? And here is Jess's response.
So there's obviously myself as the GP. I've got a family event to go to, and I can if I leave quite soon. But there's a patient that needs me, and their family need to discuss things with me that are quite time sensitive. So there's really myself to consider here. So I'm having to kind of weigh up seeing my family and going to this important event, and also kind of fulfilling my duty of care for Mrs. Andrews and also for her family. So it extends to the family and not just the patient. So there is myself, of course. There's also my partner. Being a GP, I'm sure that I've put them in quite a few situations where I haven't been able to turn up in the past when I've previously said that I could. So I'm sure that might be hard for them to kind of deal with. And I hope that upon discussing with them the situation, they might understand if I did decide to go ahead and help Mrs. Andrews. And surely I'd hope that would be quite empathetic and understand where I'm coming from. And then I might be late. I could still turn up. There's also Mrs. Andrews, of course, so she's fallen ill again and could be quite scared. And I suppose having her primary caring doctor there would help her through that. And given that her family wanted to change their decision on the do not resuscitate directive, discussing that with them as soon as possible to kind of put them at ease that they haven't, that they can make an informed decision about what they want to do with their loved one, I think is also something that really needs to be considered here, because they would be quite scared, feeling that they made the wrong decision and they don't want to kind of live with that burden. So those are the people that need to be considered in this situation.
Yep. Why is time management critical for doctors?
Yes.
Unfortunately, Jess's audio didn't catch, but this is the second half of her response.
Okay, who do I need to see first? Who needs these resources quicker than somebody else? So there are a lot of things to kind of grapple with in your mind, and thinking on your feet in a high stress environment is a really difficult thing to do, and I guess comes with a lot of practice. So yeah, it's a very important thing because you are in an environment that requires it almost all the time.
What strategies do you think successful doctors use so they can manage their time effectively?
Right. I believe effective doctors would use organization skills. So I believe that all doctors are very organized because they seem to stay on task, get the important things done, and make sure that they are where they need to be at the right time. So there's those basic organizational skills that you kind of build up over time through university, through experience, that I think are very important. And that also comes back to what I was saying before about having to triage things based on importance. And that also comes with experience. You can't really gauge how important and severe something is until you've seen it and you know, okay, this needs my attention right away. So I guess that's also an experience thing. It's something you would learn in medical school too. Suppose on top of personal organization, there's also being able to be in a supportive and collaborative team environment where you know that you can mobilize a team if you need to. You can seek help from others if you can't cope with something on your own. And you can't possibly see a way to get all of this done by yourself. So it is good having that really close-knit team and having a network of people to gain help from when you need it. So I suppose effective teamwork and collaborative environment, but also that personal organizational skill set.
Just returning back to the scenario in the STEM, what would you do in this situation?
Yes. So as I mentioned previously, there are a lot of people to consider in this situation. If it were me in the situation, I would make sure that I tended to Mrs. Andrews and her family because it is a very time sensitive and severe thing. There is a life at stake and the family's emotional well-being at stake as well. So every minute of time spent waiting is extra stress on them, which I'm sure would be so difficult for them to deal with. Added on top of the fact that their family member is really unwell again. So what I would do is call up my partner and tell them, I'm really sorry, but there's something that I need to attend to. Tell them a little bit about the situation and hope that they would understand and say, you know what, I'll try to make the event a bit late if I can, but if not, I'm really sorry. And I just really hope that being a GP that they would have probably experienced this before. So hope that they'd be on board with that. And I would try to make it up to them somehow. And then, I would go see Mrs. Andrews, talk to her family, make them feel a bit comfortable and tell them, don't stress about it. I'm sure we can make changes to the prior arrangements and kind of talk them through it and make sure that they're making an informed decision. And if Mrs. Andrews is able to join in, then of course getting her input as well.
Yeah. So those are the 4 questions. You've got a little bit of time left. Is there anything else you'd like to add to any of your answers?
Sure. I suppose in these types of scenarios where you're asked to choose between prioritizing yourself and somebody else, it's very easy in a theoretical situation to say that you'd prioritize the person who seems most disadvantaged in the situation.
That's time. So I have to cut you off there. So that's your 8 minutes.
Thanks.
Perfect. All right. So debriefing on that.
Yeah.
Before we do that, I do want to hear from you first. So just reflecting on how you just went, how did you think you went?
I think I did okay. I suppose with this scenario, it was quite easy to use like a stakeholders approach because there were so many stakeholders. So it was kind of a little bit easier to flesh out a response, which was nice. I know sometimes when there are only 2, it's a bit difficult. So I think it was okay from that standpoint. I guess I'm hoping that I covered the ethical pillars and tried to consider all the nuances. I know you can't consider everything, but kind of enough to give like a well-rounded response. I hope I didn't repeat myself at all. I think I might have covered something that was asked in a follow-up previously, and I might have said it again, kind of about how my situation with the partner and having maybe experienced something similar in the past. So I guess maybe not wasting time in saying that again. I would probably say as alluded to previously or something, but yeah. Because I guess it's just a bit of a waste of time if you've already said it and it's not adding anything. Making sure I'm not repeating myself is something I would try to work on.
Yeah, I'll just a few of the things you just said. So in terms of repeating yourself, I don't think you did that. I didn't get the impression that you were repeating yourself,
Okay.
because the questions, even though they were the context in which you provided the questions were quite similar, there were still differences in the way you've answered it. So I think you're referring to the first question, the last question, when you're talking about the partner's position.
Yeah.
So it is, you are following the same vein, but at the same time, you are fleshing out in different ways. So the first question, you were just thinking about the partner's position and how the scenario that you're currently in is affecting them. Whereas in the last bit, you're focusing more about how you would handle the situation with them and what you would physically be doing. So I don't think you're repeating yourself there. And it's definitely fine just to reiterate some of the points that you were making from your previous question, because they are quite important in your justification of why you're doing that in the first place. So regarding your stakeholder approach, I think that really helped with your structure for your answers. I think your answers are all structured really well. It was really easy for me to follow your thought process, and I could tell you were considering this situation from many different points of view. So from yourself, for the partner, for Mrs. Andrews, and obviously their family as well.
Yeah.
So that was really easy for me to follow, which is great, because having a good structure to your responses just makes things a lot easier for the examiners to understand where you're heading.
Yeah.
Good. Okay, so what I'm going to do now is we'll go through each question bit by bit, and we'll cover what you did well, what you could improve on, and stuff like that. So we'll start with the first question. So the first question, I'll just read this for you. So that was, what factors are important in this situation and why?
Yeah.
So I think overall you did a really good job here. So this is where you took your stakeholder approach. So considering the point of view from everyone involved and how any action that you take would affect them. So I think your logical reasoning there was great. And your logical reasoning as in general, I think, is a good strength of yours, because you showed that throughout all four of your answers as well. Right. So I liked how you considered yourself, your partner, your patient, and the family. Particularly considering that this would understandably be quite a difficult time for Mrs. Andrews and their family, and they must be quite stressed out at the moment. So you definitely showed good empathy there in just understanding the situation that they're in. In terms of just further stakeholders you could possibly think of, just to flesh out the answer a bit more, the stem was a little long, but they did talk about the fact that there were other patients in that GP clinic as well. So whatever action you take would possibly be affecting them as well. It could delay the time that you have to see them. They might be having some sort of serious condition as well that might need urgent attention and things like that. So there's just further things that you could think about, just exploring different other stakeholders. And if you have even more time, you could even go a little bit further than that. So beyond just the immediate people involved, and you could just think about other health, like the healthcare clinic, like the actual GP clinic itself. That can count as a stakeholder, particularly if patients start to get unhappy with the delays that they're experiencing, because no one likes having to wait a long time to see the doctor. And then that could have further implications on just their trust in the healthcare system in the future and things like that. So that's just some further things you could explore when you're thinking about the stakeholders. Cool. All right. So for this next two questions, they were a little bit tricky. So why is time management critical for doctors? And what strategies do you think doctors use? Now, I have to be honest here. If I had those questions, I would be a little bit thrown off, because I would be thinking very specifically about that scenario and nothing else. So this STEM itself covered a variety of different themes. So not only was it just a personal ethics style question where you're put in a dilemma yourself, but it was also just it's exploring a broader sense of what it's like to be a doctor and what challenges you could possibly face. The theme that this STEM was highlighting there is one of them being time management. You only have limited time, and what are you going to do in that time? So that's why it focused a little bit on time management and what do you think you could do in the future to help with that time management. So specifically with your second question, why is time management critical for doctors? I think you didn't quite answer the question. The question, specifically asking why is it critical? I think you kind of circled it, but you didn't quite actually answer the questions particularly, specifically. So you started off by saying that it's hard to understanding that it's hard to prioritize different tasks, and the importance of triaging, information so that you can provide the most effective care that you can. I think that's a good starting point. But yeah, so with questions that kind of throw you off a little bit, that are kind of left field, it doesn't hurt just to take a breath, just to take a few seconds, just to try and think about what the question is asking and try and answer that question directly. I understand that obviously when you're under time conditions, you can feel a bit stressed out, a bit flushed, and you just want to try and talk for as much as you can. But sometimes taking a few seconds just to take a breath, think about the question, think about how you're going to structure a response, that would really help as well. So it's not always just how many words you can say, it's the quality of those words that you're saying. So there are a few reasons why time management is critical. So some of it is like what you said before, trying to get through all the patients within a reasonable amount of time. As a doctor, a lot of people are relying on you, so you are part of a team. So if you are disorganized, that could mean your entire team becomes disorganized, and then that could affect how well the entire clinic or the entire hospital could run as well. You do have a lot of responsibility being a doctor, so being able to manage your time is quite a critical skill that you need to have.
That's really good. I was kind of talking about like how like it affects you as well, like balance, like work-life balance as well.
Exactly.
They're good things that I should have spoken about.
No, that's all right. You're not expected to get everything down. You're not expected to know everything, because it's very hard to be able to do that in that time limit that you have. Good. Okay. So what strategies do you think successful doctors use so they can manage their time effectively? What I recommend with questions like these, so you will get a few questions like these that are a little bit more personal, where it's, what do you think doctors can do to manage their time effectively? Or how do you think doctors can handle certain situations that might be heartbreaking and things like that, or stressful, going along that theme? What I think you could do just to help, once again, structure your response and have something to talk about, is just think about what you do now. Because what you do now, a lot of the time, you can just apply in the future as well. So now, time management is something that I'm sure is really important to you, and I'm sure you have strategies that you implement to make sure that you can manage your time effectively and get all the tasks that you need to get done. So just think about what you do. So for me, for example, I have a calendar. So I use a calendar. I write down what I need to get done every single day. I have my timetable and my schedule and everything on there, so I know what each day holds and what I need to get done each day. I'm sure plenty of doctors will do that as well. So a lot of the things that you do right now are definitely applicable in the future. Thinking about that can possibly help you just get a few ideas straight away and just help structure that response a little bit more. So those two, so questions 2 and 3, they were more just personal questions, asking about you, or a little bit more about you. And the last question, what would you do in the situation? That's very clearly based on the ethics of this of the question. I like how you structured your response. So I like how it was almost like a step-by-step process. Like you walked us through a timeline of what you'd be doing. And I think that's a great way to structure any type of question that asks you, what should you do in this scenario, or what should this person do? And that just makes it really clear for the examiners to understand your thought process and where you're trying to get to at the end of the day, basically. One thing that I'd recommend, or I suggest you think about as well when you're answering these questions, it kind of stems back from the first question when you think about the stakeholders, is how will your actions affect other stakeholders as well? You definitely talked about the partner, which is really good. Obviously talked about the family and Mrs. Andrews, who are, I guess, the main what the question is mainly focusing on. But if you think a little bit broader, there are still patients that are waiting for your care. So what are you going to do? How are you going to address that? And also, just the overall health clinic itself. Maybe the receptionist can play a role in just managing things around the clinic while you're away. Maybe there are other GPs around in the clinic that can help you out and things like that. So it was a long stem, so there was a lot to think about there. It'd be helpful to think about some other stakeholders that are involved and how your actions will affect them. So similar to question 1, I think that stakeholder approach is a good way to think about what you would do, because any action that you take in these scenarios is going to affect a lot of people. So just walking through how to approach or how to talk to each one of these stakeholders can help you just build that timeline a little bit more and help that examiner understand that logic that you are carrying with you when you're answering that response. Do you have any questions?
like in general about how I went that you think I should improve upon in these last 3 or so weeks?
So there's a few broader things that I'm looking for when I hear an answer. So they cover things, for example, like communication, logical reasoning, the structure of your response, and the actual content, your opinions and your ideas that you're offering.
Yeah.
So those are things I'm looking out for when I want to listen to you speak. I think there's nothing wrong with the communication. I think your communication is great. I think you're very clear with the way you speak. It's not. It is a formal setting. Interviews are a formal setting, but at the same time, it's still very conversational.
Yeah.
And I think you've got that balance really well. Yeah, like I said before, your logical reasoning is great. I think that ties into your structure as well. So if your logical reasoning is really sound and you're able to break down scenarios and then provide a logical response, then that naturally just helps with the structure of your response as well.
Yeah.
The content that you were providing, I think that was great. Yeah, just like I said before, there's a few extra things that I think you could flesh out and explore a little bit more. But in considering the time you had, I think you did a really good job of that. And I just want you to remember that you're not expected to be able to get everything. Like, you're not expected to be able to analyze the entire situation and think of everything, because one, you have no time, and two, I mean, you're not a doctor yet. So what we're just really looking for is your thought process, how you're breaking down the situation. So we're not expecting to hear everything. Yeah. So I think just going from today, I think a few pointers you can take with you. One, like I said before, trying to explore some other stakeholders that might not necessarily be completely obvious just from the STEM itself. Two, if you are stuck at a particular question, don't be afraid just to take a few seconds, take a deep breath and try and think about what the question is asking. And even if your answer is not going to be particularly long, not particularly detailed, just because you actually just don't know what to say, as long as you directly answer the question, I don't think the length of the response would matter as much.
Yeah.
Lastly, try and think about your own life experiences, because your own life, you've had plenty of life experience so far. So I'm sure you can draw on some of those anecdotes and help you just think about the themes of the question and give yourself some ideas on how to answer them.
Yeah, no, those are really good points. I guess 2 seconds of silence feels like a long time when you know that the time is kind of ticking.
It definitely is. I've been in your situation before and I know exactly what that's like.
Yeah, and I've been practicing for the Melbourne timings, which is 1 and 5.
Yeah.
Not a lot of time.
And I think generally the Melbourne scenarios there won't be as many things to get through as these ones. So the longer time you have, the more detailed these scenarios usually are. Just because you just purely have more time to talk about things.
There was a lot going on and Jess had a good go. If you're also MMI prepping like Jess and want feedback on where to improve, I'll keep leaving a link to our mock MMI rounds in the show notes below so you don't miss out on enrolling in our MMI circuits for this year. And I'll see you at the next station.